How long is the average recovery for?
Well, the drains can stay in usually for this 1 to 2 days, so not too bad. And the idea there, it's not like you're preventing heavy bleeding or anything. Like if it's going to bleed, it's going to bleed.
Right.
But what you're trying to do is, first of all, minimize bruising. It helps with that. And
Okay.
second of all, prevent extra fluid from accumulating, what's called a seroma. Seromas can get infected and, can cause problems. So having a drain, even just for a day, can really help.
Okay.
So I like drains. Some people don't like drains. I like drains. And then you get a wrapping. And the wrapping, again, everyone manages it differently. I usually have patients keep it on for 24 hours or up to 48 hours, and then you remove it and you use it at night, so you don't need to walk around like a mummy for a week.
Okay. Now, how long do you sleep sitting upright?
It's a good idea to do that for the first few weeks.
Okay.
So not all the way upright, but your bed at about 30 degrees.
Okay.
Yeah,
So, you
pillows.
don't need to sit upright. Okay. Okay.
No. And then the most critical period is the first 24 hours when it comes to bleeding. Because as you may have heard with facelifts, that's the number one sort of complication. And I mean, surgical technique matters, but every surgeon gets, a bleed here and there. And that means that, we try to control the bleeding, but sometimes another little blood vessel opens up. And since the face is so vascular, it's so full of blood vessels, it can cause like what's called a hematoma, which is a collection of the blood. And it's better to drain that instead of just leave it alone, because it's, first of all, it's deforming, and second of all, again, you can get infection from it. It can sort of change the overlying skin, so it's better to drain that. And usually that can just be done with a needle placed into it and aspirate. Rarely do we have to pop open a couple of stitches to get to the area. I mean, it's very rare that something needs to be really opened up again to get to a bleeding site, but it's just good to know that that's a real, it's a real risk. It's not common, but I would say 1%. So it's, but it's the most common complication of facelifting around the world.
Okay.
So
now,
what else can I tell you?
With the stitching, I guess, that goes in your head, how long does it take before the stitches come out?
So for this approach where we're going into here and here, the incisions are actually very close to the hairline. They're essentially right at the hairline.
Okay.
So they're not like further back. For the endoscopic ones, you can go further back, but when you're doing it without the endoscopes, it's a little bit easier to just go right at the hairline, and they heal just fine. The stitches come out usually at about 5 to 6 days.
Oh, okay. Okay. So it's not like you have to keep them in for 10 days or so.
No.
Okay. Is there any stapling that gets done? Oh, okay, because I was going to say, staples kind of look a little weird.
Yeah.
Too. They look painful.
Yeah, staples heal fine usually, but I just prefer not to use them. Sometimes when I'm fixing the flap, putting the flap back of the skin, I'll use staples just temporarily during surgery to keep the skin in place.
Okay.
Yeah, but those get removed before you're done. And then we wash the hair, and we wrap everything up. And then you can expect bruising for a few days, usually up to 2, sometimes closer to 3 weeks, but usually within 2 weeks the bruising is gone. Swelling it's a gradual process. It could be swollen for months, but it goes down gradually. So the first 2 weeks are the worst of it, and then slowly it comes down.
So
the process.
So when would a person be considered, I guess, looking normal, so to speak?
Yeah, I mean, that's a good question. So I would say at 3 weeks, you're presentable, but you're still going to have scars that are healing and all of that. Usually by 3 months, you can go, to like a real sort of function and not worry as much about, are people going to figure it out. But again, some people at a few weeks are doing just fine.
Okay.
But I always kind of err on the side of, telling you longer.
Exactly. Yeah, and I'd rather be with the longer versus the shorter, and then I worry, am I abnormal? At least if I know longer and I heal quicker, then I'm just one of the lucky ones.
Yeah, exactly.